I see. So yes, biometric data, as the name says, is every data you can gather from any kind or using any kind of modality from a human body or from a person, from an individual, which is quantifiable or qualifiable. So let's see. I mean, let's say the very basic form are like blood analysis. You know, any kind of parameters you analyze in the blood, and then these parameters can be expanded to any kind of data you can extract from the body. Until the newer developments, you know, with iPhones, respiration rate, heart rate, whatever activity you do, sleep. So it's all kind of biologically or body-related data, which are quantifiable, which can be gathered in a system, and then of course then used for different purposes. Yeah, so classically we use blood samples, of course, blood analysis, different kinds of parameters. There are hundreds of them, focused, of course, on the need and the diagnosis and what we are trying to get. These are the basic parameters we use. Then there are vital parameters like oxygenation, you know, when you are in an emergency room or in the ICU or during operations, vital parameters, heart rate, blood pressure, and so on. And then in the last decades, of course, with technological the progress and all these different devices we use, we can have an insight inside the body of different, more sophisticated data, right? Like, for example, electrical voltages of the heart or of the brain, or all sorts of different things. We use, depending on the specialty in medicine, you can use for your purpose dozens of different types of parameters. Yeah.
And how fast you can get this data? I mean, it's like real-time information, or you need to take a sample, go to the lab. You know how usually those.
Exactly. Some of them are real-time, and some of them need to be processed. For example, in the lab with different machines in order to give meaningful results. But more and more we have tools which allow us to have real-time information at the table or in front of the patient to have this data, of course.
Can we send that data? For example, today's a lot of surgeries can happen virtually. You know, can you actually send all of this data in real time to other location? For example, different city.
Of course, yes, you could. Yes, in theory you can do that. Of course, with all the different aspects of security and patient confidentiality and so on. But yes, in theory you can do that. Absolutely. Yeah. Yes, I can imagine, you know, if you, and this is in the medical sphere, this is mostly the case if you're aware of pathological data or of data which puts the individual at a certain risk. If we talk about athletes, they may be physically completely in a good health, but they may have, for example, a genetic alteration, a mutation. And these things, this is not common knowledge, so not everybody should know that. And it may well be, especially when we're talking about professional sport athletes who are in big clubs where a lot of money is involved, that the misuse of information which could put one or the other athlete at risk, they could be abused to change the whole career of an athlete. Absolutely. So the safety of this data is crucial, and it's as crucial in sport as in a normal hospital for any kind of patient. The data belongs to the respective individual. When we would like, for example, use the data for research purposes, we always need the patients to consent to use their data. Without the consensus, you are not allowed to use this data. So for athletes, I think...
Even though if it helps their health?
Absolutely. So in a clinical setting, Absolutely, we use this data, of course, in a clinical setting, but if you want to use this data, for example, for research purposes, we're not allowed to do so unless the patient consents. So if you imagine, of course, a scenario where you deal with an athlete, and this is not a clinical scenario, this is a professional scenario where the biomarkers or this data, the biometrical data, are used to provide an information on the physical health of the respective athlete. There, the misuse or abuse of information can have dramatic consequences, of course. Yeah, so a chip is actually a little bit a generalized term for any kind of processor or electrical conduit which is implanted or used, everywhere there are chips. So in the medical field, we're talking in general about implants. A classical form of an implant is like a pacemaker or a defibrillator, and these are devices which have a part where input information is gathered, for example with an electrode, an electrical signal in the heart, or maybe in the brain or under the skin, or some parameters related to the circulation. Then there is one part, and this is the processor, a microprocessor of the device, which is actually processing this data, and then also, depending on the programmation and on the capacity of the whole processor, has the capability to program or to react, so that there is always a chain of different processes where, for example, the processor can then define an output. If condition A in input is fulfilled, then do A or do B, or and so on. That's an important question, of course. So usually the devices are using, of course, interrogation devices which are secured. So it either communicates, it depends on the device. In our medical field, these are they have security levels on different levels, and the interrogation of a pacemaker, for example, or a defibrillator, which is a device implanted to save the life of a person, are extremely secured. Now, this is what a lot of people thought for many years, until, and perhaps you may be aware of that story, that known US politician experienced actually a hacking of his device by a person remotely. So this episode caused a lot of eyebrows, and of course alerted the companies to increase the security measures for devices. Now, if these are devices which have therapeutical consequences directly, right? We can also talk about devices which are implanted, which don't have any therapeutical immediate consequence, but only diagnostic. And these diagnostic tools, for example, like the chips you mentioned, there are of different sizes. They can be as small as a USB, then also extremely miniaturized to a rice corn. They are implanted under the skin, and the classical communication with these devices is actually with a smartphone. In the former models, it was via Bluetooth connection, and today, with an upgrade of most of the phones, they communicate via NFC, near-field communication. It's much more secure. The security level is higher, and the energy also taken out of the device is less important, so you can communicate in a good way. They don't have a battery, exactly, yes. So the tiniest device we actually see now in medicine, which is a very small device, like a rice corn, a grain, doesn't have a battery. It has a beautiful shell which is a little bit porous, and the blood analysis is allowed because the molecules go into this capsule, and then the microprocessor measures the levels, and then the interrogator, the smartphone, can be put on it, and then there is the electrical conduit starting. This is the energy given to the device, and then you have the values. I think it can be of extreme benefit for the athletes. First of all, there are no physical constraints. If you talk about, in the early times, like chest electrodes with like a vest or whatever to do diagnostic or blood analysis with invasive tools. Nowadays, with these capsules, with these micro implants, you don't have any physical constraint. You can put it everywhere under the skin, so the athlete doesn't feel actually constrained by it. Then you can level the level of your training experience, training result, the level of your aerobic, anaerobic exercise level, and so on and so on. So you can go towards a personalized diagnosis with the chip, depending what you want to know. And many blood parameters we actually gather via an invasive blood sample can be measured subcutaneously, for example, with this device. So nowadays, the chip I was talking a little bit about, the implant chip, for example, is implanted for gynecological purposes. So women who undergo in vitro fertilization, they have 4 weeks the chip under the skin in order to monitor their hormone levels. This is a very nice indication, for example, for such a implantable chip. It's small, it's not invasive, cosmetically it's perfect. You can leave it for weeks, and it follows the individuals through the hormonal cycles accurately in order to anticipate when is the best time for the fertilization, while classically in such situations these women have to undergo repetitive blood sample analysis, which is extremely bothersome, of course. Not at all. Completely negligible risk. Completely negligible risk.
And painful?
It's like a prick. You don't even have a local anesthesia. You don't need it.
It's like having a shot.
It's like having a tattoo. One needle stitch of a tattoo.
If you want to remove it, the procedure?
Yeah, that's not the problem. So the devices are implanted normally at places under the skin where you don't expect them to migrate very much. You can feel them under the skin. If you want, you can also activate it so it sends a light, it emits a light, so you can localize it under the skin and you can remove it very easily. I think it's a much safer and much more efficient way to monitor doping and a drug or substance abuse for...
Can it go through the chips?
Yes, yes. So these chips are getting more and more performant, and you can customize actually the chip depending on your purpose. You can actually put so in the chip there is an interface which can, for example, measure caffeine or any kind of steroids or any kind of substance, given the fact that it goes also outside of the blood barrier into the tissue. So for doping, obviously there is very little chance that you can cheat if you have a substance in your body and the interface and the chip is actually designed to measure the concentration in your body. There is no way you can cheat. You cannot exchange like urine or give another piece of hair or whatever. The chip is inside of your body and that's it. Compared to other means of control of substance abuse for doping and improving your performance in sport, it's much less prone to tactics of cheating. Now you know it yourself, we all know human imagination is limitless. Yeah. There may be one genius coming up and then with an idea how to remote it. But understanding the technology and knowing a little bit the system compared to what is existing, it narrows really dramatically down the possibilities to cheat.
Yeah.
Yeah. I think, you know, at the level of professional sport or athleticism you're talking about, the athletes may, and you can confirm it with me or not, at from one point on in a professional career, most athletes agree most probably to be tested, right? To undergo, you have to undergo analysis, to, you know, all these lactate levels after anaerobic sport, the ECGs and things like that. Now, I think the positive side of it is that you monitor training success on a biological level, not on a subjective level, but also on a biological level. You can monitor on an individual level also whether the pace of the training is adapted to the individual, so that it's not too fast, it's not harmful for the biological condition of the athlete to go that fast. So you can monitor it and adapt it. Now, all depends, of course, on the agreement and the consent of the athlete. If you ask me, I think personally it is not more invasive than having repetitive blood samples. This is actually more invasive, to have blood samples repetitively, to find a vein, to get blood, to stick and so on. So a monitoring device like an implantable chip is, to my opinion, really extremely micro-invasive and allows a better monitoring if, of course, the athlete consents. It is also a very good point what you're saying, that some athletes may think they can sell their data. Yes, I mean, from a legal point of view, the data belongs to them, it's their body. Now, what is the interest of selling it? It reminds me a little bit, you know, the high-level horse championships of horse. You know, you know that the horse is in a good health, so your athlete is in a good health. The athlete knows he or she is in a good health, has normal blood levels, has normal different kind of indices of different parameters, and can say, you know, I'm in a super good shape. My value biologically is along with my performance at a maximum. The downside is, of course, that if this is allowed, then people will ask any athlete for the biological data, and then maybe that some athlete is extremely performant and is extremely successful in his career or her career, but on a biological level, let's say, not on the maximum. And then the question, of course, comes up whether this person is losing market value just because of the biological parameters, and that may be some kind of a little bit a discussion in the system. But yes, I mean, the boundaries for now, for today, they are like extremely broad. Yes, yes, and it's extremely comfortable also for the patients. You know, we have in the last few decades all this biomonitoring topic came up, biometric data, gathering of them. The patients normally, they feel much more at ease and much more secure, because they know there is always a little bit of surveillance and the control. Nowadays, the pacemakers, they send the information through the satellites to our clinic. So if there is an event, the patient doesn't even have to come in. So these devices, not only pacemakers, many devices, they communicate remotely with our network, and then we have the information real time. And from a medical point of view, this development is extremely welcomed, and especially with these new devices like the implant device or patches for ECGs and so on and so on. The comfort is extremely high, the patients are much more compliant, it's less invasive, and it doesn't hamper the quality of life. And the question, of course, is then when it goes to athletes, I mean, you had an incredibly beautiful career. Would you consider having a second athletic career to having such a device, just to monitor yourself, to be aware of your own performance, and then and avoiding all the time blood samples. So I think you would say, yeah, why not? So it's much more comfortable.
Yeah.
I think we are already in the future. It has started. It has started. We are really on the edge where the technological progress has allowed to miniaturize devices extremely. And next year, the first generations of these devices will come up, and we are in Geneva privileged to be part of this adventure and start to implant such miniaturized capsules. And this, for me, this is the future. Whether then further developments can come up, you know, we have seen some other visions, like you can only with the camera of a smartphone detect via machine learning and artificial intelligence algorithms whether a patient has an arrhythmia, just looking at the face and this stuff. So these things are under development, and these things are studied now, and there are publications coming out where remotely with machine learning and AI applications you can actually predict what is happening. You can diagnose without touching a patient. So yes, I think the limit is extremely broad. So seeing the last few years of developments, I think in the next few years we will have an amazing development of very interesting things.